Why is limb preparation crucial for fracture splinting? Imagine trying to build a sturdy wall without a solid foundation. That's what splinting a broken limb is like if you skip preparing the limb first. Proper limb preparation is a vital step in first aid because it helps make sure the splint does its job safely and effectively. When you're in an emergency, taking a few minutes to prepare can prevent further injury, ease pain, and support the healing process. First, you need to check the limb's circulation, sensation, and movement before you do anything else. Feel 4 pulses in the wrist or ankle to see if blood is flowing properly. Ask the person if they can feel touch or pinpricks to check nerve function. Also, gently try to move fingers or toes to see if nerves are working. If there's a problem with blood flow or nerve signals, splinting could make things worse, so it's important to know this first. Next, look for open wounds or bleeding. Cover any cuts or scrapes with a clean or sterile dressing. This helps prevent infection, which is especially important if you're outdoors or in a survival situation where medical help might be delayed. If you see bones sticking out or debris in the wound, don't try to push it back in or clean it deeply. Just cover it gently with a sterile dressing to protect it until help arrives. Positioning the limb correctly is also key. Support it in a natural, comfortable position that keeps it stable. If the limb is bent or misshapen, gentle traction might help straighten it, but only if it doesn't cause more pain or damage. For example, if the arm is bent at an odd angle, carefully pulling might help, but only if it's safe to do so. Padding is another important step. Bony areas like the elbows, knees, or ankles should be padded with soft material. This prevents pressure sores or skin damage from the splint rubbing against the skin for a long time. Proper padding makes the splint more comfortable and reduces the risk of skin injury. Finally, gather all the materials you need before you start. Have the splint, padding, bandages, and dressings ready to go. This helps you work quickly and smoothly, which is important when time is limited. Being prepared means fewer delays and a safer, more effective splinting process. In the end, taking the time to prepare the limb properly helps protect the injured area, reduces the chance of complications, and makes the splint more stable. Checking circulation, covering wounds, positioning the limb correctly, padding sensitive areas, and having everything ready can make a big difference in how well the person recovers and how safely they can be moved.